The positivity rate, very important. The percentage of people who test positive out of the total is still down at around 2%. If you look at what it's been historically, you look at 44,000 tests, 345 positive cases out of 305 tests performed, that's about 14%. It shows you our trend is in the right direction. Total hospitalizations, that trend continues down. This is the interesting chart again, because the positivity rate is what is so important in terms of getting an idea of community spread, giving you an idea of where COVID is in the greater population. Those numbers can spike up or down a little bit depending upon nursing homes or prisons or congregate, but that trend line down towards 2% is extraordinary good news, not just for us, but for our region. And that I talk about the region because here you can see the week-over-week change in the percentage of tests that return positive. And you can see Connecticut, Massachusetts, New York, Rhode Island, New Jersey are all trending down. The number of people who test positive, the percentage of people who test positive has been going down. Unlike other parts of the country that opened up perhaps a little bit earlier or something else is going on. That's Arizona, North Carolina, Florida, Texas. If we have a positivity rate on average of about, say, 3% over the last week, Arizona's at 12%, North Carolina's at 7%, Texas is at 7%, and Texas has the highest level of hospitalizations they've had in a couple of months. So it's just a reminder to maintain, wear the mask and maintain your discipline, because you see what's going on around the rest of the country, and we're tracking that very, very carefully. And that gets us a little bit to where we are more broadly in our environment. We just got off the teleconference with Vice President Pence and Dr. Birx, and they pointed out again the nature of these flare-ups in different states around the country and what that means. Obviously, we have a high percentage of our people here in the greater Northeast that wear face masks and other cloth coverings. So important. Private gathering size limited to what right now it's 10, 50 people outside. As David Lame will say, that number is about to go up. But let's just wait a minute. We're putting in place these protocols, but I understand there's some contradictions out there, because you've seen massive demonstrations with thousands of people out there. And we're going to wait and see what impact that has on our positivity rate going forward. And those protests, remind us that we're battling two pandemics at the same time. One is COVID, that attacks the body, and the other is racism that attacks the soul. And it's that response to George Floyd that represents the thousands of people who have been protesting peacefully around the state of Connecticut. No arrests, as far as I know, over the last week or so. But I do worry that in a short period of time, we've gone from we're all in this together, that was our mantra as we fought COVID, to I can't breathe. And the irony is not lost on me that somebody suffering severely from COVID, it sometimes feels like a knee on your throat. And in both cases, you can't breathe, and you can't breathe freely. So that's the irony of when I say small groups and large groups and avoid mass gatherings. I had to think about that this weekend as I wanted to show solidarity to those people who are standing up against racism and standing up, as did our state police and our municipal police, stand up with the protesters. And yet I also wanted to make sure we stayed aware of where we are in the COVID crisis. So I went to a small outdoor church service in Bridgeport with about 100 people in their cars. A religious service handled appropriately, and talked about racism and how it impacts all of our different communities. I was sort of interested that at our meetings with Vice President Pence, everybody's talking about the impact of these demonstrations in their different states. You know, Andrew Cuomo from New York's told everybody, and they've got thousands and thousands of people, cheek and jowl, protesting. He wants everybody to go get tested. Dr. Birx had some simpler advice to the protesters. Don't go visit your grandparents for 2 weeks. Stay away from those most vulnerable populations. I'd just like to say, in terms of where we're going forward, on this next slide, this is our guidelines for, they say here, phase 2. But I noticed that in New York, our neighbor, we often look to our neighbors to see where we are in the reopening cycle. They've just started what they call phase 1. And in New York, phase 1 is opening manufacturing, opening for outdoor construction, letting a retail business be available for pickup only. Well, as you know, Connecticut never stopped any of those things. So if that's phase 1, then what we did on May 20th, where he opened up for outdoor eating and later on hair salons and the such, that was our phase 2. So in many ways, what we're going to be doing on June 17th, in about 8 days, is our phase 3. And as David can explain, we're opening up, in effect, about 95% of our economy. Very quickly, as you can see on this chart, lodging. You remember hotels, we said only for first responders. We didn't want a lot of back and forth traffic between New York and Connecticut and Massachusetts. But now we all have more or less the same low positivity rate. We think this is a calculated risk and help our tourism industry get going. Sports, gyms, pools, you understand what that means in terms of back to a new normalcy. Outdoor amusement parks. Some of these are large amusement parks, and David Lehman has been invaluable working with all the folks in these different trade associations, coming up with the protocols that make sure their employees are safe and give the customers confidence they can get back. You know, personal services, this is the rest of the personal services, everything from nails to tattoos. Indoor recreation, including bowling, major outdoor events. We're opening those up a little bit as well. David can explain what some of the parameters are there. We tend not to limit the number of people. We do tend to think in terms of capacity and limiting the number of people who can park, just to make it easier to maintain that spacing, just as Katie Dykes has been doing at our beaches and parks over the last few months. Finally, I think the outdoor dining has worked pretty well. And if you've had a chance to go eat outdoors, I know I was really looking forward to it. Everybody's maintaining the protocol seriously. We had very few complaints. So I think we're ready to go with the indoor dining, which will be also on June 17th. And then finally, libraries. So this gives you just a little bit of an idea of how we're getting back to our new normal. 95% of our economy is open, but that is all subject to, let's see what happened over the last week or so. Given the protests, Memorial Day, we seem to have weathered that in terms of not a big uptick, and time will tell. So far, so good. David, anything you'd like to add, or should we just take some questions?
No, Governor, I think you said it well. As you mentioned, this really is the big phase of our reopening. There is a considerable amount of businesses that are going to be open. There is a third phase in mid-July that we're also anticipating. But after June 17th, the vast majority of our economy will be up and operating.
Eyewitness News.
Yes, Governor, just wanted to ask, as we look forward to phase 2 of the reopening, where do we stand on the testing? I know that you mentioned that we've done around 300,000 tests so far. Are we meeting that 100,000 per week metric?
Why don't I let Josh Jabal, our testing czar, answer that question?
Yeah, thanks, Governor, and thanks for the question. So we have successfully scaled up our laboratory testing capacity to well over 100,000 at this point. And, as the Governor mentioned, we're in the top 10 states in the country per capita in terms of the testing that we're doing, and our positivity rate, as he said, is low and continuing to trend down. We are reevaluating how we deploy some of those tests based on some changes in CDC guidelines. And we're also struggling with some vague and often contradictory advice from the federal government in terms of what's going to be reimbursed for testing. So we're taking some time to really ensure that we're deploying all those tests in a way that delivers both the greatest public health benefit, as well as financial sustainability for our testing program, knowing that we're going to be at this for quite some time. So we're going to keep pushing forward hard with areas that we know are critical: nursing home testing, prisons, testing in our densely populated urban communities that have been hit so hard. But in some other areas, we may be dialing back a little bit where we don't see as much public health benefit. But we've got the capacity created that we need to ensure we can meet the public health challenges.
News 8.
Good afternoon, everyone. Governor, I wanted to ask you two things. One about the independent analysis for the nursing homes and assisted living. It seems like, sometimes you need to take a step back and go over things in order to make the step forward. So do you kind of see it as that, to understand preparation and all that stuff so you know what to do moving forward? And the second question would be with respect to weddings and kind of where all that stands right now.
Well, first of all, in the nursing homes, obviously that was the tragic center for our state and the other 49 states in terms of fatalities. And if there's a chance that there could be a second surge later on this summer, more likely in the fall, we want to be ready. And so we have a strong outside group that focuses here in terms of infection protocols, PPE, and more long-term, what our nursing homes are going to look like. So I thought that was an investment worth making so we can learn going forward and to be able to share those notes with our fellow governors in the region, because they're doing much the same type of analysis. Weddings, as you know, we've got graduations up to 150 people outside. You say, hey, I can do graduations, how about weddings? Our thinking right now is that we want to be a little more cautious with weddings. You're eating wedding cake, you're not wearing a mask, there's maybe beverages involved, there could be dancing. So it's a much more social, less inclined towards social distancing than, say, an outdoor church service. But that said, we're going to be taking a look at that over the course of the next 2 weeks.
Governor, if I could just jump in there. Quickly, I was on with the event industry this afternoon going through this, and as you mentioned, in phase 2, 50 person outdoor events, including weddings, will be allowed, and then in phase 3 in mid-July, we anticipate that number going to 100. But that is something we need to give a further look to, not just outdoors but indoors, giving some sense of what type of capacity, perhaps with a cap, can be done, whether it's in July or beyond indoors. So we're actively having dialogue with the industry there, and we're going to try to provide as much clarity as we can.
News 12 Connecticut. Fox 61.
Hello, two questions this afternoon. First of all, for the governor or the commissioner, we saw the date for the reopening, the phase 2 coming, moved up a little bit to June 17th, but we only just got guidelines over this past weekend for what businesses need to do to have that certification to reopen. Do you think that's enough time for businesses to address everything that they need to do in order to get back to business?
Go for it, David.
Sure. It's a great question. I do is the short answer, for really a couple of reasons. One of the concerns we heard in phase 1 was the availability of PPE and disinfectant cleaning supplies as well. And we've really seen that market loosen up. There is a lot of availability. It's easier to find, and there's less lead time that's needed. So that was a concern before, but I think it's less of a concern right now. And secondly, a lot of the guidelines that we put forth as it relates to hygiene, mask wearing, up to 50% capacity, that's consistent in many ways with what we did in phase 1. So I think a lot of businesses saw the phase 1 guidelines and anticipated something very similar, which is what we delivered over the weekend. So businesses are eager to get back to business here on the 17th of June, and I think they're ready.
And the second question for the governor, we've heard a lot with the protests over the weekend and even last week that there were calls to either defund or disband police departments right here in Connecticut. What's your stance on these calls, and should any Connecticut police departments be defunded in your view?
No, I don't think we should be defunding. But what I think many of the protesters mean, and I think rightfully so, is that we consider a police response the answer to a broader and broader variety of societal ills. And in many cases, you may find that it's a social worker. You may find that it's a mental health expert. You may find that it's an addiction expert. And we're asking our police to solve all these, where in fact, I think we need other folks who can get involved in the community to make a difference. That's why our community liaison is going to be a bigger piece of our portfolio going forward.
Thank you.
NBC Connecticut.
Regarding George Floyd and the protests around the state and the country, Governor Cuomo called back the legislature in New York this week, looking to pass several bills banning chokeholds, prohibiting false race-based 911 reports. Governor, are you planning on doing anything similar?
We're planning to do something similar. Paul's in conversations with the legislative leadership, coming up with a program that a legislative agenda that makes a lot of sense, and criminal justice reform and police accountability will be at the top of that list.
Is there a timeline on that, and would you be looking to ban chokeholds in the state?
Yes is the answer to the second question. What's the first question, Paul?
The timeline, we'll be setting the timeline once we are in full agreement with the governor, with the legislative leaders on the actual bill. But we are working in earnest, working with the Legislative Committee of Cognizance as well as legislative leaders. So we'll have more details on when the governor will officially call them back into session, but that is the governor's intent.
And then for Josh, regarding contact tracing, where do you think stand there? Is it in line for the phase 2 reopening? And then for the nursing home report, could there be any disciplinary actions coming out of that?
So on the second question first, we'll unlikely. I mean, I think this is an opportunity to learn, right, what we can do, what we did right, what we can do better, preparing both for a second wave and looking longer term. With regards to contact tracing, the team continues to make great progress, bringing on local health departments, bringing on more volunteers, continuing to ramp up. We hope to have our first snapshot of the metrics around that by midweek, recognizing that some local health departments are going to stick with their local processes in the short term, so we need to be able to consolidate all that data to see all of the contact tracing that's going on across the state at this point in time.
Thank you.
WTIC 1080 News.
Hi, Mr. Governor. Having listened in on the police task force earlier, I know you were on there for a while. Some of the recommendations the task force has are getting officers to listen more and listen better, to de-escalating situations, all the way to eliminating police chases in cases of there's an equipment problem or something, dented fender, something like that. What are some of the top things that come to mind for you that you'd like to see the task force suggest?
Well, thank you for that question. First of all, the legislature made a great, important down payment, I think, on police accountability. Really limited use of force, put in place clear escalation procedures, talked about chokeholds, talked about the fact that video cams should be more prevalent. Video cams have to have the video released within 4 days. These are some of the programs that they put in place last year, and along with that was the Police Accountability Task Force. That Police Accountability Task Force, as you pointed out, I met with via Zoom today, just to see we have not done enough. What else can we do in terms of confidence building so that people have confidence that their municipal and state police are there protecting them? And just as importantly, how we can make sure that there are clear guidelines for our police. We talked about required use of video cams, required use of body cams, making sure that that is available to everybody, that they use those. Perhaps we monitor those on a more regular basis. We spent a fair amount of time talking about, and I know James Ravella over at the State Police is already planning to roll this out, again, community liaisons, so that each and every one of our troops has a close relationship with the community leaders spread across, different segments of the community. So when things come up, we're ready, we're in communication, and we can work together. And finally, I've been thinking about what are the rules of the road for bystanders? In particular, those cops who are standing by. You saw what happened with George Floyd. I saw some police just standing by, not getting involved. What should be the consequences for them? That, more broadly, training will be some of the different programs and ideas and recommendations that come out of the task force. And I think you're going to see another bill, as we talked about before, coming through the legislature informed by that task force.
Highway protests last weekend, a couple times. With the 95 shutdown around West Haven, is there anything else state police can do about that, or is that just something that's to be expected at this point?
No, we've mitigated that a lot, I got to tell you, and we've done that in part because our public safety officers are meeting with the community leaders and the protest leaders and saying, look, we may share some of the same goals in terms of what we're protesting about, but you've got to do it safely. So I think we are managing through that. Time will tell.
Boceto Media. Associated Press.
Good afternoon, everyone. Governor, there's a national group that represents assisted living facilities, and they're seeking $5 billion in federal emergency funding, saying that nursing homes have received this money to help pay for PPE and testing, but they haven't. I know a large chunk of Connecticut's share of the CARES Act is going to nursing homes. What about assisted living facilities, and will that be part of this analysis?
Why don't you take that, Josh?
I know it's something that our team and OPM Secretary Melissa McCaw, our DSS teams are constantly monitoring. I think nursing home situation financially was certainly the most precarious and most in need of immediate injection of cash to ensure that the resources were available to keep the staffing levels where they needed to be able to acquire PPE and increasingly be able to afford testing. But that's something we'll continue to monitor.
And have there been any issues with the casinos since they opened a week ago? And maybe if you could get into also, what are the industries that are still out there for the third phase?
Paul was, touching base with some of the folks, as was David, and the tribes. I think they've done a pretty good job. I think they're going in, they're saying if you're required to wear a mask, wear that mask. So it's a little bit of a wait and see right now, but I think the prospects, fingers crossed, so far, so good.
And how about what's left for phase 3?
I think phase 3, you'll see bars, perhaps. You'll see a big indoor events. These are, again, areas that not inclined towards social distancing, often indoors. So I think that would be the next phase.
Thank you very much.
Thanks, Sue.
Connecticut Public Media.
And started a petition saying that they reopen this just it means December, and then realize that's so true if they have a mask on and they worry that.
Max, we can't get this.
Connecticut Public Media, we will come back around to you. Your audio is cutting in and out. Move along next to the Connecticut Mirror. Connecticut Mirror.
Yes. With you?
We can hear you. Move along next to the Hartford Courant.
Hi, this is Emily Brindley from the Courant. My first question is about nursing homes, which I know you've touched on a bit already here. But can you explain, just kind of from the beginning, why you decided to do an independent review now and what exactly you're hoping to learn from it?
Sure. So we wanted to initiate this now as the situation has become more stable in our nursing homes. Certainly there's still a lot of work going on and there's a lot of difficult situations being dealt with, but in anticipation of potentially a second wave, many of the experts think that could come in the fall, perhaps. We wanted to do this work now to see what we could learn as quickly as possible in terms of what worked well, where we can improve, and what we can learn from it so that as we get to the second wave, we can put as many of those recommendations in place as possible to try to prevent similar impacts as we saw in this first wave.
Okay, thank you. And then I also wanted to ask about contact tracing. For the second phase of reopening, it looked like your goal was to do contact tracing for about 50% of cases. And I think you're only at about 10% by Friday. So what happens if you don't reach that goal? And is there any plan to incentivize or enforce participation from public health districts?
Well, our plan right now is to invite the public health districts to participate. We do recognize that they're incredibly busy. They're operating under an immense amount of stress right now, not just in terms of the normal responsibilities that they have, dealing with the pandemic, also being involved in enforcement of a lot of the reopening guidelines. So our public health departments are working incredibly hard. So we want to give them time to be able to onboard to contact at the rate and pace that fits into their workload. I've spoken to a number of the local health directors. I joined a call with them on Friday. They're enthusiastic. They get the concept of and the value of having the entire state on one common platform. So the rate and pace at which they all come on board, may spread out a little bit longer. But that 10% number you cited doesn't include the contact tracing that is already happening at the local level. That's just what's in the contact platform. So as I mentioned on a previous answer, one of the things that we're doing is we're going to survey all of them to find out the additional contact tracing that's happening locally. Like New Haven was very early to this game and stood up a big local operation, so we'll have to consolidate their numbers in a couple other local health departments to get a full statewide view.
And do you expect that full statewide view, do you expect that to reach 50% of contacts as the second phase goal is?
I'm not going to predict on that one. We'll see the data later this week.
Connecticut Public Media. Connecticut Mirror. Hearst, Connecticut Media.
Hey, thanks, Max. Hi, Governor. Sorry I didn't make it down to the Iglesia Bautista Emanuel Church with you yesterday. Could you talk a little bit about what the parishioners there were concerned about as far as the police brutality and racism and the like?
It was a really moving service. As I said before, Ken, I wanted to go there because it was a group that experiences racism and were part of this overall pandemic. Maybe not quite as directly involved as George Floyd. I was struck by the fact that they were in their cars, they were wearing masks, they were taking the protocols very, very seriously, and didn't mind in the least, I don't think, that they were outside in a parking lot still enjoying a really important worship service. And we just said, God is as likely to be here as he is indoors. So we didn't have a great chance to necessarily talk about the impact of George Floyd on a one-on-one basis, but I know that it was on top of mind.
Thanks. And Governor, since it seems to be a lull in the COVID outbreak at this point, and you did order the review of the nursing homes, can families start thinking about possibly visiting their loved ones in some of the facilities?
Yeah, we have had some discussions about that, different ways you can do it, get tested and go in, outdoors. I think it's a little early so far. Any more thoughts on that, Josh?
Yeah, no, the team is working on some visitation guidelines, starting to look at how we can reintroduce that, as the governor said, particularly looking at the opportunity for outdoor visitation where appropriate.
Thanks. And can I ask David if he's getting any pushback on the open up protocols in business?
Ken, thanks for the question. Right now we've gotten a little bit of feedback, a lot less than we did at phase one, so it's still early, but so far the rules have been well received. So my expectation is, given we put 9 documents out there, there will be some dialogue, and we'll continue to do that with industry as we get ready for the 17th, and we'll keep this group posted if anything changes on that front. But so far the feedback's been good, and less feedback than we saw in phase one, less questions than phase one.
I was asking if there was pushback, sorry.
Feedback and pushback. Sometimes it's one and the same in terms of what comes into the email box. But no significant pushback to speak of at this point in time. But we'll keep having the conversation. It was just posted yesterday morning, so a lot of folks are still going through it and reading it. But we'll report back if there's some pushback, or certainly if anything changes with respect to the guidelines.
Thank you.
Thanks, Ken.
Waterbury Republican American.
Thank you, Max. What is the timeline for getting this independent consultant on board? The announcement speaks to doesn't really speak to a timetable.
Yeah, our hope is to have start soliciting proposals this week, receive them, award the contract by the end of June, so we can get started as quickly as, no later than the end of June, so we can get started as quickly as possible.
Okay, and Josh, you mentioned earlier that there was going to be testing was going to be dialed back in certain areas that were not deemed as high a public health priority as other testing priorities. Could you give us a couple examples, please?
Sure. So, based on CDC guidelines, based on some of the early pilots that we've done over the last month, ramping up testing in a number of areas, we've observed, certain populations are simply less interested in getting tested, and from a public health perspective, maybe are at less risk. So some examples could include some smaller congregate settings, for example, where there's less people. We may just do a point prevalence study, for example, like a one-time study to see what the prevalence is, enable cohorting, but not do it on a repetitive weekly basis. That would be one example.
Like a residential care home? Is that what you're talking about?
Yeah, the size matters a lot, right? So when you're talking about a large prison or a large, congregate facility, we'll probably want to maintain more frequent testing there. For a smaller facility where you may have, a single-digit number of residents, for example, the public health benefit is just a lot less. So you might do like a one-time test. And that's based on guidance we've seen from the CDC. Another element of this is that new guidelines that have come out that said if you test in one of these facilities completely negative for 14 consecutive days, so all residents, all staff, if you test negative for 14 consecutive days, then you can pause the testing. So that's another area where we know that we already have a number of homes that are in that category that may not need repetitive testing.
Okay. And then I do have just a final reader question. I don't know who would be positioned to handle it, but it's from a mother whose daughter is out of work and on workman's compensation, and she's questioning why her daughter doesn't qualify for any assistance like the extra $600 federal pay-up for unemployment benefits. She says this is another group of people that are forgotten.
Well, yeah. No, Paul, as you probably know, each individual person's situation is individual and to that individual. So if you feel free to send us a note offline, we'll be happy to have the DOL team look into the situation further.
Okay, so that might be a better question than for folks at DOL, right?
Correct.
Okay, so that's on Thursday. Thank you.
CT News Junkie.
Thanks, Max. Nursing home staff started getting tested this week. Do we know how many of them have tested positive, and if it's created any staffing shortages?
Well, nursing home staff testing has been going on, at some homes. Took the initiative to get started on this several weeks ago. We have not had any reports of staffing shortages as a result of that at this point. But yes, you're right. It will certainly start to really accelerate this week based on the governor's executive order, one of the first states in the nation to take such an action to mandate staff testing. But the team is, one of the reasons we gave some time to phase this in over the next couple of weeks is to ensure that the homes are prepared and that we're prepared to help them if there are staffing needs that arise.
Okay. And the inspections by DPH and the National Guard, are those still ongoing?
Yes.
And will we have access to the independent review?
Yes.
And Is the state going to continue using nasal swabs to test nursing home residents?
We are piloting saliva-based sampling as well. We actually have the first lab in the state that has submitted for federal approval to use saliva as a sample, which will make it easier in many cases. But for now, we're continuing to use the swabs.
Okay, and I know that we know how many tests we've given. Do we know how many individuals have received those tests?
How many individuals? I'm not sure the difference between the two.
How many tests, like the 300,000 is the amount of tests that Connecticut has given, but one individual could have received many tests.
I understand your question now. I don't have that number at hand, but we can see if we can find that for you.
Okay, thanks.
The Day of New London. Connecticut Public Media. The Connecticut Mirror.
Good. I think we've exhausted those media outlets. Let me just say, a lot of questions today about task force and laws and regulations as regards what we learned about police accountability and how we can do better. And those are all good steps, but I just wanted to read something that came from our state police last week, because you can't regulate what's in the heart. And this is what Commissioner Ravella and Colonel Malikas sent out and was received by all the state police regarding George Floyd in Minneapolis. Those police officers on the scene in Minneapolis, including those that stood around and did nothing, they simply failed, the state police write. If you wear a badge and aren't appalled by what you saw, please turn it in and find a new profession. We don't need you. For the sake of the community, for the sake of good law enforcement officers everywhere, and for the sake of our country, enough is enough. I think that's the sentiment in the heart of the state police. I think working together with the protesters, that's why we were able to stand up for a higher cause with a minimum of violence and looting. For that, I'm very appreciative. Thanks, everybody.